Welcome to Wellness with the Anxiety Doctor. I'm your host, Dr. Lisa. I'm the host of the Anxiety Doctor podcast, and now we're branching out to bring you a more holistic approach to wellness. We're connecting the mind, body, heart, and soul, bringing you experts from all different areas of wellness. We're also bringing you everyday people sharing their incredible wellness journeys with us. Today's guest is Dr. Rebecca Berens, who is a board-certified physician. She's also a board-certified international lactation specialist. She's the founder and lead physician at Vida Family Medicine here in Houston, Texas. We talked about the health system here in the U.S. and how flawed it is. We also talked about the GLP-1 craze and health insurance. This episode was recorded September 2024, prior to the horrific event that happened December 4th, 2024. We do not condone violence. With that being said, let's get started. Before we get started with today's episode is brought to you by Grounding Well. I've been using a grounding sheet for 6 weeks, and the benefits have been incredible. I've been telling all of my friends and family about the benefits of grounding and how incredible the grounding sheet has been. I was skeptical at first, but the benefits have been so incredible in my life. I sleep better. My inflammation is significantly lower. They just sent me a grounding mat that I'll be using here in my office. Stay tuned for more information on my Instagram. I will be talking about the benefits of grounding, but if you're interested in purchasing a grounding sheet or a mat, we have a discount for you. Click the link in the bio to get our incredible discount from Grounding Well. Today I have Dr. Rebecca Berens, which I'm very excited to talk to. I'm so glad that you're here, Dr. Berens. Let's start with a very basic question. What is DPC?
Yeah, thanks so much for having me. Yeah, so DPC stands for Direct Primary Care. And that basically means it's a practice centered around a direct physician-patient relationship. So we don't allow insurance companies to interfere in that relationship. And so one of the ways that we do that is rather than using a fee-for-service model, which most people are familiar with, which is, you pay per visit with your doctor, and you may, pay cash for that visit if you're not using insurance, or you may use your insurance as a claim for that visit, and then there's the back and forth with the doctor to pay for it. Rather than doing that, we use a membership-based model. So that membership means that your care is all included in that membership. We don't have to kind of nickel and dime you every time you have a quick question. We don't have to say, oh, you need to schedule an appointment for that just so we can bill. We can care for you in the way that makes sense. And so that might mean having you come into the office for a visit because we need to examine you. We need to have a discussion. It might mean we do that visit virtually because I don't need to examine you and it's more convenient for you to not come in. Or it might mean that you just shoot me a quick text message in our secure messaging app and I answer your question and saved everyone a bunch of time because we were able to take care of what you needed.
Yeah. Why did you decide to go that route instead of the traditional private practice?
Yeah, so I came from a background of working in community health. So I was working in safety net health clinics, which I loved. I loved those patients. I loved, the work they were doing in the clinic, but it was very stressful. It was very time intensive. We had a minimum number of patients we were expected to see every day, which was a high minimum number. We were often double booked. We were often adding on last minute walk-ins. And it just was, not conducive to me being able to actually spend any time talking with patients or any time for myself, because by the end of the day, I was completely depleted. And so by the time I had, kind of come out of that system, I had my first child. I had determined this was not a sustainable way for me to work and parent. And I kind of knew any system that I was going to be in that was under the fee-for-service model was going to be the same. Even if you're in a hospital-based system or even a private practice that's taking insurance, at the end of the day, if you're taking insurance, you get paid per visit. So your incentive is always to pack in as many visits as possible. Like that's just how that works. And with insurance companies, especially, they set the prices and the prices go down instead of up. Everything else costs more and the insurance reimburses you less. And so it's like every year you're going to be expected to do more and more and more for less and less and less money just to keep the lights on. And I just didn't see a way that that was going to be sustainable or possible for me to provide the care that I wanted for patients, or to be able to be a normal human outside of my work.
Yeah. And obviously that affects the patient too, right? You have to see these patients. You have to see a certain amount to be able to pay the bills. So the visits are shorter and shorter for the client. And, it's ridiculous what I hear from my patients. Their visits with their doctor is 6 minutes, 3 minutes. A psychiatrist visit is just really literally writing the script and, okay, any complaints with side effects? No, you're fine. Okay. 2-minute session with their doctor, which is ridiculous. And for people that really truly want to help, we go in this to help people and to care for people. It's really hard for us to continue that model and continue with how flawed the system is. Insurance companies every year cut back. And it's very difficult for us to even give discounts. A lot of people don't know that we cannot waive the copay. It's illegal. And there's people that can't afford their copay sometimes. I have a big heart. I'm a giver. And that was very difficult for me. I used to accept insurance. I was on almost every insurance panel, and I left 3 years ago, and I'm not looking back. There's so many restrictions too with accepting insurance. There's so many guidelines that we have to follow. So I'm so happy that there's more and more doctors, more and more physicians and healthcare professionals moving past that and going to this membership type. What are some of the things that you feel you can do now with your patients that you weren't able to do when you were in a traditional private practice?
So I will, based on those restrictions you just mentioned, I'll give an example. So one thing that I hear patients complain about constantly, that they realize when they go to an insurance-based practice, when you go for your annual physical, it's free, right? You get a free annual physical from your insurance. But the second you bring up any concern, it's no longer considered a physical, and the doctor is required, like you said, required to bill not an annual physical visit. They're required to bill a problem visit. And so patients get so angry because they're like, I came in, this was supposed to be free, and you're billing me. And they're upset at the doctor, and they're like, why are you billing me? You're just trying to rip me off. And it's like, no, your insurance company, this is the requirement. Like, I have to do this. If you don't, it's insurance fraud, right? And so it creates this like negative energy between the physician and the patient, because the patient feels like the doctor's ripping him off. The doctor's upset because they know the patient's going to be upset. And also, it's just inconvenient for the patient, because you come in for your physical, you would think that would be the time you would bring up your concerns to your doctor. But now the doctor is sitting there wondering, okay, do I interrupt this patient while they're talking and say, do you want to talk about this today? Or do you want to make this your physical? Or do you want to schedule another appointment? Like, it's just disruptive to the entire flow of the visit and the relationship.
Like, of course, I want to talk about this now.
There's like nothing positive about it, right?
Yeah.
So now it's like, if I have a patient come in, it doesn't matter what their visit's for. They scheduled it for one thing, but something came up between then and now, or they thought of something else. Like, we just talk about it. It doesn't matter. It doesn't affect anything. No one's upset. If it is something where, like, I had, budgeted X amount of time for their visit and it's going to need us to spend more time, we initiate the conversation, we start the initial workup, and then I'm like, hey, let's do these things. Let's come back and follow up on this. It doesn't need to be a huge deal, but that is such a big deal when you're in an insurance-based practice, because of all those restrictions that the insurance company places on the doctor, that then makes the patient feel, like they've been ripped off. And, I whenever I hear patients complain about it, I'm angry on their behalf because it's ridiculous. But I also feel so bad for the doctor, because the doctor is just getting like dragged through the mud, and I know it's not their fault. But the system that we have, it is not designed for physicians. It's not designed for patients. It's designed for the insurance company to have leverage to deny as many claims as possible, so that they don't have to pay, and maximize their profit from the patient.
Yeah. And then take back too, right? It's a big thing with us. They just decide to not pay you for 6 months because they need more documentation. There we are working more than our, initial visit with the client. And these are things that are very frustrating for us, that we, truly want to help our client. So in DPC, a lot of people think it might be really expensive, or, can I afford this? Is this really going to be something that I can afford? I know that your membership is very affordable, I think. And, people might think it's maybe $500 a month. Talk about that, the membership fees.
Yeah. So, every DPC practice is going to be different because, like even my practice, according to some DPC doctors, is expensive. I don't really feel that it is based on, the care we're providing, but it varies depending on the patient population you attract and how active those patients are in coming to see you. Like if it's a patient that you're seeing regularly, very frequently, obviously that means you see a fewer number of patients, so the pricing is going to be higher. If you have a patient population that's not using the membership very often, they're not coming in that often, then you can handle more patients, so that it tends to be lower. It's volume dictates the price to a degree. But to me, I always look at it in how is that investment protecting you later? Because if you are able to invest in actually understanding your health, understanding any conditions you currently have or might be at risk for in the future, and you're able to make some changes now that might drastically reduce your risk of serious complications from those illnesses later in your life, that investment is going to save you so much later. It's going to save you money on healthcare costs. It's going to save you time and energy and wasted time in doctor's appointments, hospitalization costs, ER visits. So I think the conversation about cost really has to be in like, what is the value you're getting from that? And when you go to a doctor's visit now with insurance, if you have a high deductible plan, like I do, I have a high deductible insurance plan. I'm sure we all do at these points. You pay the entire cost of the visit until you meet your deductible, right? Unless it's your free annual physical. So you're paying out of pocket the full cost of that visit for 5 minutes. How valuable is that? It's not. And so I think the discussion really has to be more about the value you're getting out of your healthcare dollar rather than like, this costs too much. Because I think that people talk about this with contractors, right? With your house, it's like, it's very expensive to hire cheap contractors because yeah, you saved money the first time, but maybe it didn't go properly and you have to have someone else come in and fix it, or it breaks down again and you got to have it redone. If you're cheaping out at the beginning, you're going to end up paying the cost of that later.
Yeah, I agree. And most insurance for people that don't work for a corporation, that are entrepreneurs like me and you, they're very expensive for just one person. And if you add your kids, very, very expensive. And you're right, the high deductible makes it really hard for us to ever be able to have the insurance company pay for anything. And so we're paying out of pocket already. I'm a big fan of the DPC model, not only because I think it's affordable with what you get, but just the time that you get with your physician, being able to text them. Nowhere can you find doctors giving out even if it's not your phone number, but it's a texting, a software that you use. You don't find that anymore. Mm-hmm. And with the DPC, it's a little easier for you all to do that, to be more accessible for your patient.
Yeah, absolutely. And, I think that the issue with entrepreneurs, like you mentioned, I have a lot of patients who are in that exact situation. They're a business owner. When you pay out of pocket for that insurance, like you said, you never get to use it. And even if you do end up using it, a lot of those plans are HMOs. They're very restrictive. You have to go to an in-network PCP to get a referral written. Yeah, if you can find one, you find the in-network PCP, you go, they have to write the referral. Like, it's so much paperwork, it's so much headache. And I think for me, I also view shifting to this model as my way of advocating for system change. Because if you continue to participate in the system that you know is broken, that is actively harmful to people, you are contributing to that harm. You are saying, this is okay, this is fine, everything's fine, we can keep doing this. And I just don't agree with that. And I think there could be a different system where people have the ability to use their healthcare dollars more wisely, more appropriately, for better value, and lower everyone's healthcare costs. But it takes coming out of that system. It takes a lot of people coming out of that system to force the hand, because the system is very profitable for a lot of people who have a lot of lobbyists, and no one's going to change it for us. They're happy with how it's going. So if we want it to change, we have to force that change by refusing to participate anymore. And I think, I get a lot of flack sometimes, or I hear people maybe not directly saying it to me, but peripherally saying like, oh, it's so unfair to not take insurance. It's so inaccessible. And my argument is insurance is inaccessible. And if I decide that I'm going to participate in that, I'm perpetuating that inaccessibility. And I don't feel that that's right. So yeah, am I individually changing the whole system? No, but like if enough of us do it, the system will have to change.
Yes. Yeah. With therapy and psychotherapy, some insurance companies only allow 6 visits a year. It's ridiculous. And, and even with even Medicaid, Medicare, with Medicaid, if someone wanted to come see me, I can't see them because I don't accept Medicaid and they cannot pay out of pocket. So there's so many, it's just really flawed. And a lot of people don't realize how flawed it is and how these restrictions can and do affect the patients. And that's what we want. We want to change. We you have an oath to do no harm, and we want to help the patient. We want to make sure that we have the time to talk about their eating habits, their social network, like their support systems. And when you have a traditional private practice, you cannot do that.
No.
Doctors, physicians cannot talk about that. They have 4 minutes because they overbooked just because of the no-show rates. That's another thing.
Oh yeah. Well, and to that point, all those like socioeconomic, societal factors that are affecting people's health, not having those social connections, being sedentary all day at an office job, not having time to cook meals at home, having to grab food on the go because you're so busy. The reason that people are forced into that type of lifestyle is because they're keeping their corporate job so they can keep their health insurance, so they can keep going to the doctor for their chronic illness that they have because of the excessively fast-paced American lifestyle. I mean, it's all wrapped up in the same thing. And so we have to break the system a little bit to come out of it and start from scratch and build something that actually works for people, that actually allows people to live more healthy, balanced lives where they're not stuck in their corporate job that they can never leave because they're so afraid of how they're going to afford healthcare. I hear that all the time. Like, even from doctors. There's so many doctors that say, like, I would love to do DPC, but I can't because I need to have insurance for my family. Kids. Yeah, exactly. Yeah. And it's just like, how unfair is that people feel trapped by healthcare costs in a job that is actually killing them.
Yeah. We're talking about food and how that affects our health. You're an anti-diet doctor, which I love. And I love the content that you share on your Instagram. Talk about that.
Yeah. So I follow a health at every size approach. Health at every size is a concept that's been a while, for a long time. I did not come up with it. But it's basically, the idea is that any person of any size, regardless of their weight, can pursue improving their health. And it doesn't have to mean intentional attempts at weight loss to improve your health. And in fact, there can be harm from intentional attempts at weight loss. So like me personally, I had an eating disorder when I was in college. I'm pretty open about that. I see a lot of patients who have struggled with maybe not diagnostic criteria for eating disorder, but significantly disordered eating, or maybe an actual eating disorder that really has disrupted their life. And going through that, maybe even still going through that, or having recovered from that, the risk of going back there is very high. Suicide rates are high in people who struggle with disordered eating. There's a lot of comorbid mental illness with that. And so focusing on weight loss to me is harmful to patients. And there are other things we can do that we know improve health that don't have to result in weight loss to still have a benefit for someone's health. And so I would much rather focus on those things. The other thing is that when you're very focused on a person's weight, people who have a higher BMI, which BMI, I think, is very flawed. It's not a metric that I use, but that is often what's used in the doctor's office, right? You walk in and they tell you, oh, your BMI is this, you're overweight, you're obese, you need to lose weight. That becomes the focus of the discussion and the visit instead of addressing what's actually going on with the patient. And I've had patients tell me all sorts of ridiculous things. I had a patient who had chronic diarrhea for years, and I was sure they had inflammatory bowel disease. And I referred them to a GI doctor. And before even looking at their labs, doing a colonoscopy, anything, the GI doctor was like, well, maybe if you lose weight. And I'm just, that's so inappropriate. And this is why a lot of times people who are in larger bodies do have worse health outcomes. Why would you want to go to the doctor and hear that over and over and over again, instead of actually having your concerns addressed? Exactly. And so that is something I'm very passionate about. And that's the approach that I take with patients.
Yeah. Let's talk about BMI and the new BRI.
Yeah. The body roundness index, which I will say, because I'm always one for nuance. I'm sure this came from the right place, but I don't
use the right term, though. The right.
I mean, I think so. So here's the thing: BMI is a very, very old calculation. It's based primarily on like white European men many, many, many years ago. So obviously not applicable to the larger population anyway.
Not the Latinos like me.
But it's a calculation based on your height and your weight. That's it.
Yeah.
Doesn't take into account muscle mass, doesn't take into account, varying genetics from different genetic backgrounds, doesn't take into account any of that. And so it's inherently flawed. It doesn't actually tell us much of anything. It's like telling me your body's surface area. I'm like, okay, like what does that have to do with anything? And so the body roundness index was an attempt to address the inherent flaws in the BMI by trying to better categorize, like, okay, is there excessive visceral adiposity, which means like fat deposits around the organs in your abdomen? Because we do know that visceral adiposity, or fat around the organs, is associated with metabolic disease, and so is more likely to be an actual indicator of some health issues. Yeah. And so that's why they came up with the body roundness index, because if your middle is more round, then you likely have more body fat stored there. So you're more likely to have this metabolic disease. Okay, fine. My issue with it is, why do we need that at all? For an individual person, like I can see population health-based studies, maybe they want to use some sort of catch-all.
Yeah.
It's whatever. That's not what we're talking about. We're talking about for individuals. Patients. It's not relevant. And there's still going to be inherent flaws, because body size and shape is different based on a person's genetic background, based on a lot of other factors. And you are definitely going to make some flawed judgments when you're just using mathematical calculations like that. If you're not taking into account lifestyle habits, if you're not taking into account family history, if you're not taking into account, like, what do their actual lab work look like right now? What is their actual blood pressure right now? Like, these are individual factors that we can use to assess a person's health. So why would I need to get this random calculation that I know is inaccurate? So for an individual person, these are just not relevant numbers, in my opinion.
Yeah. So the new BRI, what are they trying to change, and what does the R stand for?
Yeah, so it's body roundness index. So they're basically trying to say, how round are you? Is your middle section rounder, in which case you are more likely to have more visceral fat? So the calculation takes into account more things. It takes into account height and weight, just like BMI, but also waist measurement, hip measurement, sex is included in that. So, there's more features built into the calculation. So it's probably a closer approximation than the BMI, but it's still ultimately an approximation, and it's still going to have flaws. And so, the way that these measures are used now, unfortunately, is they are being used at an individual level, which is not what they were designed for. They were designed for population health descriptive measures. But what happens is insurance companies will use these measures to deny care. So, for example, a patient with an eating disorder who needs to be admitted for treatment, but their BMI is normal, or God forbid, their BMI is obese. suddenly the insurance company is not as worried about their eating disorder anymore, and they may deny their treatment. And when a patient goes to the doctor, a lot of insurance companies now are trying to move away from the fee for service because it's inherently flawed, as we discussed, and they're moving towards a more value-based payment, which means they pay the doctor based on the outcomes the patients have. So that's, in their mind, they're paying for the quality of care of the doctor. So then when you go to the doctor and your BMI is overweight or obese or whatever, based on the categories, the doctor then is required to click some boxes that said, I told the patient to lose weight. I told the patient to exercise. I told the patient to do the XYZ thing. And so now they get proof to the insurance company that they are providing quality care. So these are the ways the measures are being used that are inappropriate. It's not what they were designed for. And that's why I don't find them to be helpful in individual patient care. And I think it's actually harmful to have them involved in individual patient care.
Yeah, I agree. We share a lot of commonalities with our viewpoints. One of the reasons why I didn't become a psychologist, I have a PhD in psychology, is because I don't believe in these old assessments and giving someone an assessment and finding, kind of diagnosing someone with just these very old assessments that were, created in the 1960s. I think we've updated a lot of assessments now, psychological assessments, but I don't agree with that. My view is to sit with the patient, talk to them, find out their history, find out more about them, what they're doing, their current situation, and then we can treat after that. So I'm really glad that I had you on the podcast, and again, I appreciate your time. Let's talk about the GLP-1s, the popular Ozempic craze that's going around with not only celebrities, but, our loved ones too.
Yeah. So, that's out of the focus on weight that we have in the healthcare system and then also societally. That's where that craze came from, right? These medications have actually been around for quite a long time. So GLP-1 stands for glucagon-like peptide, and these are glucagon-like peptide receptor agonists. So they are involved in affecting glucose metabolism and also in slowing movement of food through the intestinal tract. And then they also have some effect in the brain on like hunger and fullness in the brain. And so they've actually been around a really long time for diabetes. They've been approved for a long time for diabetes. They became very popular very recently because, over time, the class of medications they have tinkered with and found, Ozempic and Wegovy, and then also now Mounjaro and Zepbound, which are GLP-1s plus GIP. So there's, additional effect that it's having.
Two receptors or two.
Exactly. So, they're doing slightly different things there, but, they've been tinkering with this over time, and they've learned that, when the meds initially came out, weight loss was a side effect. And so then the discussion was, could we use this for weight loss to help people who maybe don't have diabetes but are struggling with their weight? And so they've tinkered with it. And now the ones that are out now are significantly more effective at causing weight loss than the initial ones were. And they've specifically studied them to see if they were safe in non-diabetic patients. And that's how they got these FDA approvals. And so now that there are multiple options FDA approved for both weight loss and diabetes, and then also, I think, combined with the advent of TikTok, they have exploded. And so, we have a societal preoccupation with weight and body size and shape and body image. And this, especially on social media, that there's filters, there's what I eat in a day, there's weight loss transformation videos, like it fits right in. And so it took off. These medications can be extremely beneficial for some patients. Patients who are struggling with significant metabolic dysfunction. I think it's very unfair to say to a patient, just because they don't have diabetes, like there's no medicine that can help you. You just need to try harder. That's not fair. There's people who really struggle with metabolic dysfunction and could really benefit from using a medication, even if they don't have diabetes yet, because we could prevent them getting diabetes. We could prevent them getting, fatty liver disease that causes hepatitis that could progress to cirrhosis. There's a lot of things we could help patients with that are not just treating diabetes. So they can be beneficial. But the problem with the sort of societal preoccupation with them is now what I've heard some people say on social media or in articles is there's no excuse to be overweight now, which is extremely unfair. And also it's rooted in this assumption that being overweight is bad or being a certain weight is bad. There's different genetic sizes that we are going to naturally be. There's size diversity based on, there's diversity of hair colors, of eye colors, of heights.
Yeah.
We don't assume one of those is superior to another, but for some reason, when there's genetic diversity of weight, we assume that is bad. And so there now, I think just it has increased the societal occupation with body image and body size, and combining that with social media, it's extremely dangerous. We know that during the pandemic, when everyone was online even more than we already were, eating disorders increased. We know that's a risk of especially teenagers being on social media. And so now to be on social media and seeing these drugs that you can go down to any med spa and get a compounded form.
Exactly what I was going to
sent to
talk
you
about.
There's a lot of people misusing the medication or having it prescribed to them in a way that is not appropriately monitored, is not safe, is not the intended purpose of the medication. And that is going to cause real harm.
Yeah. So I was reading the article that you were quoted on literally the same day I got on Facebook, and I had tons of different companies offering a GLP-1. Virtual appointment, just have it mailed to you the same day and receive the next day. I'm like, what the hell is going on? And I've already seen that there's a lot of med spas out there offering that. I think it's dangerous because some of these med spas have a physician that is the director, but is usually not there. What do you think about that? All these med spas offering these GLP-1s.
Yeah, I mean, I think it's inappropriate. A med spa initially it's for cosmetic procedures. That's what they are designed to do, right? And so I am not trained in giving Botox or fillers or doing lasers. I'm not trained in any of that, so I don't do it. I don't know why someone who is trained in cosmetics but is not trained in treating metabolic disease has decided that this is now in their purview, but it's inappropriate. And like you said, there are a lot of med spas, unfortunately, that may have a physician medical director somewhere out in the ether. They're probably not on site. Almost most of the time, they're not on site. And the person that is actually on site may or may not actually have the training necessary to do even the cosmetic procedures, never mind these very serious metabolic medications that should be monitored appropriately. And so, to me, it's not what the existence of med spas is legally regulated, and that's not what they are designed to be doing. And especially when there's not proper oversight. And, unfortunately, I hear a lot of stories of med spas where the supervising doctor is an ER doctor, is a pediatrician, is like random. They're not actually trained
not
in
even
any
in
of
the
these
same
things.
city, maybe.
Not
Sometimes
in the same state. I mean,
state, but
we just had that death in Texas at a med spa, and the person who owned that med spa wasn't even a medical person. They did not have any medical license at all. They were not a nurse. They were not a nurse practitioner. They were not a PA. They were just a lay person, and a doctor had rented their license essentially to this person. So, I have no problem with med spas. If you're going to a med spa to get a cosmetic procedure done, just do your research, make sure the person actually has the appropriate training in the cosmetic procedure. GLP-1s are not a cosmetic procedure.
Yeah.
They are a serious metabolic medication. It needs to be properly monitored by someone who is trained to manage metabolic disease, which is a family physician, an internist, and a chronologist for the most part.
Yeah, I agree. It's really scary to see all that. So you practice a holistic approach. One of the things that I teach all of my patients is meditation. I'm a big advocate for meditation. I've been meditating for 20 something years every single day. It's something that has helped me. I have rheumatoid arthritis and lupus. I'm currently not on medication. Been having flare-ups, so I went to go see a rheumatologist here. I'm not going to mention any names, but when I was, sharing my experience with the medications that I've taken, the side effects, just my history, I told him that I take very good care of myself. I don't eat a lot of sugar. I try to avoid foods that are inflammatory. And he told me that food will not help my rheumatoid arthritis, and that doesn't matter what I eat, that if I have RA, I have RA, and that's it. And I told him that I meditate, and he literally rolled his eyes and basically laughed at me. I was really, really shocked to hear that. I know that there are a lot of physicians out there that still don't believe in meditation. I know you do, which I love. How have you seen, or what have you seen in your patients that, or family or friends, that meditation has helped them physically and mentally?
Yeah. So there's actually research behind it. So
I know. I wanted to pull it out, but I was so shocked. I didn't know what to say. I didn't want to be rude.
yeah. Well, and that's,
My
I mean, that's,
Latina, my spicy Latina was going to come out.
but that's the thing, when you're the patient, that physician patient, there's like a power dynamic there still.
Right? It
And I
is.
think it's very important for us to be mindful of that and not abuse that. Yeah. So meditation, there's actually evidence behind it. And it has been shown to improve management of anxiety and mood disorders. It can help improve blood pressure and lower
Yeah.
blood pressure. So there's a lot of things it can help with. And when I always talk to patients about like overall health and wellness, there's certain pillars that I always address. So nutrition is one. Getting adequate nutrition baseline. You need to have enough
Yeah.
calories coming in, and then the right types of foods. You need to have adequate fiber. You need to have adequate protein. You need to have adequate carbs. We do need to eat carbs. You need to have adequate fat, and an appropriate balance of those, so that you are meeting your needs. Movement is another big one. So not being sedentary all day, getting adequate movement, not killing yourself at the gym and injuring yourself, but getting significant movement throughout the day that makes you feel happy, that makes you feel energized, that makes your body feel good. And then the others are, avoiding substances that are psychoactive or harmful in any way. Social connection, which meditation plays a role in that too. Often, there's often, meditation in groups or in meditative practices that you might do in a group. And then stress management is a big one. And so meditation can be so huge for stress management, lowering anxiety, helping to take a pause in the day, stop the anxiety spiral in your head, and be able to manage that stress. And that has a huge impact on inflammatory conditions, like you mentioned, and also on metabolic disease. And so, when I talk to patients about their health, and I'm never saying it's diet and exercise. Those are two pillars, but they're only two. Oh, and sleep. Yeah. That's the other one. Sleep is my big one. I don't know how I forgot that one. Sleep, I have a whole other soapbox on sleep. But these are all the pillars, and stress management and social connection are huge. And I think those are the ones that are most overlooked. And those are places where meditation can be really, really beneficial.
Yes. Thank you. Thank you for that. He was an older physician. I was very shocked, but it's definitely helped me a lot. Again, I've been in remission for a very long time. Recently, I've had flare-ups, but meditation truly helps me. And I know it helps with inflammation. So, one of the reasons why I wanted you on the podcast is because of the holistic approach that you encompass in your private practice, and the amazing things that you're doing. So, with that being said, are you still accepting new patients? And if so, how does your membership work, and where can they find you?
Yeah, absolutely. So we recently moved our office to Sugar Land, Texas from the Heights in Houston. Nice. So I'm accepting new patients, and I also have a partner that's just joined me, Dr. Anushree Kumar. She's accepting new patients. She's an internist, and she follows a very similar approach as I do with her care. And we're both accepting new patients. Our website is vidafamilymed.com. And the best way to reach out if you're interested or want to learn more is we do have an option on there where you can just fill out a form to schedule a meet and greet. And then one of our staff will kind of give you the rundown, talk to you about any questions you have about how the membership works, and then help pair you with the right doctor. Because we have different niches, she and I. So we usually she tries to pair you with who she thinks is going to be the right doctor for you. And then you actually get to meet one of us on a call before you decide if you want to enroll. So you make sure you feel comfortable.
That's amazing.
Yeah. And so then once you meet with us, we basically give you the enrollment information, you enroll, schedule your first appointment. That first appointment is usually a lengthier intake because we are doing like a full health history review, physical exam, all that. We usually order labs or any other tests we might need at that time. And then we follow up from there and we kind of make your individualized plan for how often you need to follow up, what we need to follow up on, any recommendations we have for, lifestyle measures or then potentially medications if necessary. And that's kind of how it works.
Awesome. Thank you so much for being with us. Is there anything else that you want to share with our listeners?
No, thank you so much for having me. I think we talked about all my favorite topics, so I really appreciate it.
Awesome.
And I'm just really grateful to you for having this space where you're having these conversations, because I think it's really important for patients to learn about the options that are available to them, because I know so many people are frustrated with the current system and don't feel like they're getting the care they need. And you're a huge part of helping them. So I appreciate that.
Oh, thank you so much. Thank you so much for joining us. And I appreciate you can come back whenever you like.
Thank you.
Thank you so much for joining us today, and join us every Tuesday as we bring you a new episode every week. And don't forget to join us every first Thursday of the month as I bring you a solo episode, wrapping up everything that we talked about and giving you tips and tools on how you can improve your overall wellness. Don't forget to follow us on Instagram, Apple Podcast or Spotify Podcast, and now on YouTube. All the links will be in the show notes. Stay tuned.